This is the patella. The patella or your kneecap. From now on, for you is the patella. I introduce you to the patella. This is the anterior convex side of the patella, and look how it's posteriorly smooth, right? So it's a sesame bone, remember, which means that it develops within a tendon, in this case, the quadriceps tendon. And it has so a triangular shape. So the base points superiorly and the apex points inferiorly in here, or distally, I should say. Um, and is placed on your skeleton just like my hands are so big. Okay, just like that. Okay, so remember, if the posterior smooth surface of the patella articulates with the patellar surface of the femur and forms the patellofemoral articulation. This articulation allows it's a plane articulation, so allows the gliding of the patella across the surface of the femur as we flex or extend the knee joint. Um, let's describe the leg. So the leg, just let's start. Oh, let me put the camera here so you can see the other side of the other image. So the leg is just from the knee to the ankle. It's just this area. And yes, I repeat it and repeat it and repeat it, and I know why. On the leg, we have two bones. Medially, towards the midline, we have the tibia. Okay, so see both tibias, they're the thickest bones in here. And laterally, we have the fibula. Fibula, la. So you can remember it's lateral. Okay, so this is the anterior view. You can see the fibula is medial, the fibula is lateral. In the posterior view, the same thing, the tibia and the fibula. Both bones are joined together by this. Is this a tendon or a ligament? It's a ligament because it's uniting two bones. So, and that's the interosseous membrane. Unlike the interosseous membrane that we found on the forearm, this one allows almost no movement at all. What else? What else? Okay, let's describe, and I'm going to do this at the same time. The proximal end of both bones and then the distal end of both bones. So proximally on the tibia first, we're going to find two condyles. Remember, articulating surfaces. Let me grab my big tibia. Look at that. Look at how it looks like. Flat head, Frankenstein. So it has these two condyles. The medial, this is the medial, this is the lateral. And I'll tell you later how do I know. But in this image that is already articulated, you know the lateral is facing the fibula. So that's the lateral condyle, that's the medial condyle. On the posterior view, again, the medial and the lateral condyle. These two on the superior surface, they have these articulating surfaces. For what, you may ask? Exactly, to receive the femoral condyles to form the knee joint, which is on the next video. Right in the anterior aspect of the tibia, you will find this tuberosity. Remember, it's just a rough elevation of the bone, of the surface of the bone, and that is where the the patellar ligament attaches. Patellar ligament that we'll describe later. But important to keep in mind. What we have on the fibula, look how easy it is. We just have the head of the fibula. And distally, look, the distal aspect of both bones. Let me show you in the articulated easier. Look at that. It's supposed to be, okay. Look at the distal aspect. This is the tibia. This is the fibula laterally. And see that both of the bones end in these pointy projections. They're not styloid processes. Please have seen that mistake a lot of time. Styloid processes are only present on the radius and ulna on your forearm. In your ankles, those are the bulges, the bony processes, the bony parts that you can feel on either side of the ankle. Those are the malleolus. And we have the medial malleolus, of course, in the medial bone on the tibia, and the lateral malleolus on the fibula, which is the lateral bone. Okay? Here it is, medial and lateral in the posterior view. Now, these two bones, remember, they, just like the radius and ulna on the forearm, they articulate proximally and distally to form the proximal tibio-fibular joint and the distal tibio-fibular joint. The proximal allows maybe gliding if on the two bones, but actually most of the time is considered a synarthrosis. I'm sorry, delete that. It's a diarthrosis. But this one might be involved in the movement of dorsiflexion of your foot, which is this movement. But actually they are not, for us, there's no significance on the movements of the proximal and distal tibiofibular joints. See you in the next video. We're going to discuss the knee.